What is cortisol? Cortisol is your body's stress hormone that affects your mood, motivation, and fear. It works with your brain to send messages throughout your body. Hormones are chemicals that carry messages in your body, telling it what to do. A cortisol test checks if your cortisol levels are normal by measuring it in your blood, urine, or saliva. It helps doctors understand how cortisol is affecting your body. What are the main functions of cortisol? Cortisol is a hormone made in your adrenal glands and released into your blood. It has different effects on your body because almost all of your cells have receptors for cortisol. It helps with things like controlling blood sugar, reducing inflammation, affecting memory, regulating salt and water balance, and even supporting the development of a baby in the womb. Your brain can sense if your cortisol levels are right, and tells your adrenal glands to adjust the amount of cortisol they release. And depending on what your body needs, cortisol can change or pause certain functions like digestion, reproduction, immune response, or growth. Causes of high cortisol level. Sometimes if there's a lump in your adrenal gland, or a tumor in your brain's pituitary gland, your body can start producing too much cortisol. And when that happens, it can lead to a condition called Cushing's syndrome. This syndrome can cause a bunch of health problems like rapid weight gain, easy bruising, weak muscles, diabetes, and more. Now, having high cortisol levels for a long time is actually quite rare, and it's called Cushing's syndrome. There are a few reasons why this can happen. 1. Taking a lot of corticosteroid medications, like prednisone, for treating other conditions. 2. Tumors that produce a hormone called ACTH, usually found in the pituitary gland, but sometimes in other parts of the body like the lungs. 3. Tumors in the adrenal gland or excessive growth of adrenal tissue, which causes an overproduction of cortisol. Causes of low cortisol levels. Low cortisol levels can happen because of a few things. Stopping corticosteroid meds suddenly, after using them for a long time. Autoimmune disorders like Addison's disease that attack the adrenal glands. Problems with the pituitary gland, or adrenal fatigue. Certain medications or infections like HIV or tuberculosis. Surgical removal of the adrenal glands. Tumors or metastases affecting the pituitary or adrenal glands. Genetic causes.
Reference ranges. Note: reference ranges can vary lab to lab. Serum: 7 a.m. to 9 a.m. 4.30 to 22.40 GDL. 3 p.m. to 5 p.m. 3.09 to 16.66 GDL.